What's going on, everyone? Welcome. Thanks for tuning in here for our little chat with Dr. Jason McKnight. He's a clinical assistant professor at the Texas A&M College of Medicine here in College Station. Dr. McKnight, let's just start out first, and you can give just a quick background on your areas of study and your areas of practice in the medical profession.
Yeah, sure. So, like as you mentioned, I'm a assistant clinical professor of primary care and population health with the College of Medicine. My main job is in the training of family medicine residents with the residency program here in Bryan, Texas. Primarily from a clinical standpoint, I am mostly a hospital medicine physician. I was taking care of, all adults in the hospital, including COVID patients. And then I have some responsibilities in the outpatient clinic as well.
Sure. So when we look at contact tracing, that's been the big word with A&M football. Of course, they had their game against the postponed this weekend because they had what they said was 2 student-athlete positive cases and a student worker positive case. But they were under the 53 scholarship player threshold because of contact tracing. From a medical professional standpoint, could you give the definition of contact tracing and why, for those anybody who doesn't know, why this would affect these athletes and the ability to play the game?
Sure. So contact tracing in general is just going back and looking at, anyone who's had exposure to individuals who have tested positive, in this situation for COVID, but, of course, they've used contact tracing for years for other reportable diseases. Depending on your organization or what's going on, the kind of requirements and what they designate as who needs to be traced down can vary a little bit. But in general, what you're looking for are individuals that have what they call a high-risk exposure. And that's someone that, for generic purposes, was within a certain distance for a certain time period of someone that is now tested positive for COVID-19, and maybe even during the period where they were in the asymptomatic window. And so those are individuals, that get tracked down, and then they say, well, because you were exposed, you could certainly test positive. But even before you test positive, you may be infected and may then also be able to spread this infection. So you need to be on quarantine, for 14 days or whatever they've designated.
So when you talk about the effects that COVID-19 could have on a football team and on a program, why is these safeguards, the masks, the distancing on the plane, why would that be important? Because I know a lot of people say that, well, these are young kids, these are athletes. Why is it important to maintain these safeguards and maintain this kinds of contact tracing and everything?
Sure. Of course, adhering to the safeguards, the biggest thing is to prevent spread of the infection. Now, of course, if it's a bunch of young, healthy football players on a plane or in a practice facility that you're worried about spreading it to, certainly their risk of complications and of having a serious disease course is lower, than an older person or someone with other health problems. However, we do occasionally see young individuals that are otherwise healthy that do have a fairly severe course of infection. But even outside of that, one of the things we have to worry about is who does that young, healthy athlete expose, even if they're going to have a mild diseased course, right? Because they may have a family member or a friend, that they then expose that's not so young, not so healthy, and may have a worse outcome. And so, it's not only to protect those athletes, but also, the people that they interact with and the general community at large.
Well, why was it 14 days? I'm always interested because a lot of times we're seeing that mostly there's, the contact tracing works out well. We haven't seen, we only cover athletes, and we haven't seen a spread. Why wasn't it? It's not 7 or 10, and some conferences are different, I guess, as far as what what is the optimum time for contact tracing. I guess that's what I'm asking.
Sure. And, as far as what other conferences do, or even what the Southeastern Conference does, I can't necessarily comment on what decisions they made that went into that day. What I can tell you, though, is, in general, the Center for Disease Control and Prevention recommends, 14 days. The reason for that being that in the evaluation of people who have been exposed to COVID, it seems that anyone that's going to catch it is going to catch it by day 14. There are specific data that I've seen, but I'm not going to quote them today because I don't, have them in front of me. The vast majority of individuals are going to test positive by like day 11, but there have been some instances where individuals have tested positive up to that 14-day mark. But it seems very rare that someone would be exposed, but then develop symptoms or test positive after 14 days.
I know we're seeing stories. Go ahead, Cease. Go ahead.
No, I was going to say is also, Doc, if I could ask is, we hear a lot. We deal with sports, so they're telling us, well, they go on the plane, they get into these small meeting rooms because on the road they have poor facilities, so they're interacting a lot. But now some people said, well, maybe this because of Halloween, everybody got out. I let their guard down. There was a lot of people. Is the bottom line is, which one of those do you think is worse, or you're not going to make a judgment on those two scenarios?
Sure. I think it's hard to say for sure. Certainly when you do have a lot of individuals in a tight space together, like the practice facilities or whatever, you are increasing the risk for spread. Now, what we have seen with, Memorial Day, 4th of July, other holidays, we have tended to see spikes in cases, 1, 2, 3 weeks out from that. And so just based off the time course, I think it's a decent assumption to make that, outside events and Halloween parties, and of course people, not following social distancing guidelines during those events probably, had at least part to do with this spike in infections.
When you look at any group of the football team size, to be able to go this far in such a close environment and not really have either an outbreak or a huge contact tracing incident like this, is that pretty impressive for what everyone was gauging and seeing how this virus spread over the first couple of months of the pandemic?
Yeah, honestly, it's a kind of subjective thought, but yes, I do think, that the ability that programs have been able to go this long fairly successfully is a mark that, they've done pretty well in making sure that everyone adhered to the guidelines that were necessary. But, I do think it's one of those things, you're kind of playing a game. The longer you go on, of course, that risk is increased just because you are spending more time with, strangers and in tight quarters and not socially distanced appropriately. But also as time goes on, we have seen that people are tending to relax on their adherence to the recommendations. So I can't say it's surprising that it's finally happened, but I do think it's been really good that they've been able to go this long without having something like this.
Yeah. And then the other question, too, that I know people are asking is, you look at the case like Saban, who had a positive test, took a couple of tests afterwards. Those came out negative, and he, quote unquote, tested out. And there's a lot of debate on if contact tracing should always last the 14-day period, as you said, regulated by the CDC, or having the abilities to test out like professionals. What is we've kind of gone over the benefits of isolating for the 14 days. What is maybe the detractions or why people might be a little slow to adopt a testing out process after that?
Sure. I think for one thing is, as far as I remember, the official guidelines, for even testing after an exposure, you still have to quarantine for the full 14 days. The reason for that is because what they found is, right, you have to get a certain amount of virus threshold in your body before you're going to test positive. But individuals can actually be contagious about 48 hours prior to that point where they have a positive test. And so really the only way that you could say definitively that, okay, a negative test means you're good to be around other people, if we could like have that test be 48 hours into the future. Because I could test negative, say I got exposed a week ago. I could test negative today, but I may test positive tomorrow. Well, then anybody that I've had contact with from yesterday going forward is technically exposed, even though I tested negative today. And so that's the issue with the testing out strategy, is that just because someone has tested negative even after an exposure does not mean that they're going to continue to remain negative for that full 14 days.
Gotcha.
Let's say that you have a football team, you get 20 guys get COVID in March. I don't have to worry about those guys anymore. Can I say, oh man, you can go ahead and room with these guys, you can get close to these guys, that they wouldn't get COVID anymore? I don't have to worry about, from a coach, I don't have to worry about those 20 guys anymore?
Unfortunately, we don't have great data to know for sure either way. What we have seen, though, there are some reports that there have been individuals that caught COVID very early on in this process, in the spring, that have since caught it a second time. So we do believe, in all the research going on into vaccines right now, we do believe that once you caught it, that you are kind of immune to it for a period of time. But what period of time you're immune to recatching it, we don't actually know. And so I think, for the first, month or two, I think the odds are pretty good. But like I said, we just don't have data to say, no, you're going to catch it again, or, yes, you might.
Well, that wrapped up all my questions. Cease, do you have anything left?
I guess just, in a team like this, we're talking about a team traveling. And, I find it interesting. This is the first time I really traveled since the COVID. Travis and I also went to South Carolina. You get on it was completely full, the American one. You get out, we go out and eat. You run into a lot of people. I'm thinking, somewhere along the line, we probably run into a person that's going to test positive, maybe and you don't even know it.
Right.
I just see it's hard for those teams when they go on the road and they can't we all can't stay at home all the time. But I'm just saying it would seem you can see why teams go on the road and they come back and maybe have COVID.
Yeah, absolutely. And, like I said, I think every organization that does contact tracing looks at what they consider a high-risk exposure. Sometimes they look at it a little bit differently. Last I checked, the CDC's official thing of high-risk exposure is, being within 6 feet of someone for more than 15 minutes without wearing a mask. And so, right, we're all out in public, we're going to stores, we're going to the grocery store, you're going to restaurants. As long as you wear a mask when you're out, and you're keeping your distance from strangers, that's why your risk of kind of catching it just being out and about is fairly low versus, sitting down to have a meal or sitting on a plane next to somebody, that may have it. That definitely puts you at a higher risk of catching that illness.
Sure. So before we wrap up and close, from what you have knowledge of these situations involving football programs and college football, or just the virus in general, is there anything that we missed out that stands out to you as these problems continue to evolve and as this pandemic continues to evolve into where we are this year right now?
I don't think so. I think the biggest thing that we just always have to keep in mind is that we're all tired of doing all these social distancing thing. We're tired of not going. We're tired of not going to parties. We're tired of not spending time with family and friends. We're tired of not socializing. And I think one of the reasons that we are seeing new spikes is because people have relaxed a lot on the social distancing aspect. But I think we have to keep in mind that right now the only mechanism we have of minimizing infection spread is, social distancing when you can, wearing a mask, washing your hands, and then if you're sick or have been around somebody sick, just stay at home. The risk of spreading that to loved ones or friends or that sort of thing is way too great than, going and hanging out for 30 minutes if you're feeling bad.
There you go. Well, thank you so much, Dr. McKnight, for giving us a few minutes of your time to kind of help clarify a lot of these terms and ideas that are being bounced around now as A&M had a game postponed this week. Again, that's Dr. Jason McKnight, and be sure to check theeagle.com for more information as we move through this postponement week.
All right, thank you, guys.